Well, lung cancer is the second most common cancer in both men and women, and is the leading cause of death. Well, Dr. Ravi Patel with the Comprehensive Blood and Cancer Center joining us to talk more about the risks, screenings, and the latest treatments available. It is Lung Cancer Awareness Month, so it's the perfect time to be talking about it, right, Dr. Patel?
Very important month. Very important to remember that there's a lot of new things available for lung cancer, new treatments, a lot of new ways to detect it early. The best way, of course, we want to get rid of lung cancer is not to smoke. So,
and we did just see that story about quitting smoking. So, you know, a lot of people these days are also, if they quit smoking, they go to e-cigarettes.
Yes, so now e-cigarettes is another story. People think that e-cigarettes are safe. They're not as safe as people think. You know, the e-cigarettes have these cartridges, and these cartridges are powered by a battery. Two things happen. There's a lot of other chemicals released by the cartridge, and those chemicals are carcinogenic. It has formaldehyde and acetaldehyde and toxic. The other thing which has been reported now is that about 20 to 25 cases of explosion of e-cigarettes with really fatal, significant damage to arms, face, other parts of the body. And the other thing for younger children, teenagers are taking e-cigarettes at a higher rate, affects the brain. The nicotine still is there, and there's clear evidence that nicotine can damage your brain. So you have to be very careful about that.
Now, smoking, a lot of people, you know, I just saw a story the other day of a woman who had a cough, and she was diagnosed with lung cancer, and she said she was never been a smoker her entire life. So there's other things that cause it, right?
Yes. So non-smokers can get lung cancer also. About 4% of lung cancers happen in non-smokers. And they have a particular genetic mutation, many of them, which can be targeted by certain drugs, which have been developed with excellent response rates. And the good thing about cancer treatment is that there are many new ways to outsmart it. So, for example, two powerful ways to attack lung cancer now is to use the immune system to attack the cancer. And so much so that now immunotherapy is coming before chemotherapy to attack certain cancers. And the other important thing is identifying the genetic mutations within the cancer and targeting them also is a very powerful way to control cancer.
Okay. You are doing a free screening, right, for the month of November. So real quickly, because we're running out of time, can you talk about the screening? Very
important. It's for people who smoke frequently between the ages of 55 and 75. A low-dose CT scan has been proven to pick up cancer a lot earlier than a chest X-ray, and it can be done in less than a minute. Has less radiation exposure than a regular CT scan because you don't use any contrast. And it's available for the remaining month of November. It's for free, so people who are heavy smokers can call us, and we'd be happy to do it for them.
Okay, can't beat that. Well, Dr. Patel, thank you so much for all your knowledge and information. Okay, Health Alert.